Periodontal instrumentation involves the precise use of instruments to remove plaque and calculus, ensuring gingiva health. Techniques like scaling and root planing are fundamental. The presentation is designed for third-year Bachelor of Dental Surgery students, drawing from Newman and Carranza's Clinical Periodontology, 13th edition. It focuses on educational purposes, adhering to fair use principles for academic and non-commercial objectives. All content rights are retained by the original copyright holders. This presentation has specific learning objectives which will help students to answer the following questions and apply the concepts clinically. What are the principles of periodontal instrumentation? Describe different methods of vision, illumination, and retraction while performing scaling and root planing, various instrument grasps and intraoral finger rests, different types of extraoral fulcrums, discuss instrument activation and how to accomplish a correct instrument adaptation on tooth surface, various angulations of bladed instruments during scaling and root planing and gingival curettage, and types of strokes and how they are activated. Principles of instrumentation makes up the heart or core of scaling and root planing. These can be easily learned by the abbreviation AVSACC, assuming A for atria, V for ventricles of heart, SAC since heart is sac-like organ, and two Cs since it is a double-layered structure. Therefore, AVSACC indicates A for accessibility, VIR for visibility, illumination and retraction, S for instrument stabilization, A for instrument activation, which comprises of adaptation, angulation, lateral pressure, and stroke, C for condition of instrument, and C for clean field. These elements collectively ensure thorough and precise periodontal care. Ensuring thoroughness in instrumentation requires correct positioning of both patient and operator. The clinician should be seated comfortably with feet flat and thighs parallel to the floor, maintaining a straight back and erect head. Patients should be in a supine position, with the maxillary arch requiring a slightly raised chin and mandible to be lowered and parallel to floor, particularly for lingual surface of anterior teeth for optimal visibility and accessibility. Direct vision with direct illumination is ideal for the mandibular left premolar area. Indirect vision using a mirror is essential for the lingual surfaces of mandibular posterior teeth. Indirect illumination, achieved by reflecting light with a mirror, enhances visibility in the maxillary left posterior lingual region. Indirect vision involves using a mirror to view the palatal surfaces of maxillary anterior teeth. This technique is paired with indirect illumination, where the mirror reflects light onto these surfaces, enhancing visibility. This method is crucial for detailed examination and treatment in areas that are otherwise difficult to access directly. Effective retraction techniques vary based on the procedure's location. A mirror can deflect the cheek while fingers retract lips, protecting the mouth's angle. Alternatively, the mirror alone or fingers can retract lips and cheeks. Mirrors can also retract the tongue. Often, a combination of these methods ensures optimal retraction and visibility. Why we should be careful during retraction in these cases, which shows clusters of fluid-filled vesicles on lips. The answer is these are recurrent herpes labialis patients which are prone to developing herpetic lesions post-instrumentation. Careful retraction is crucial to prevent triggering these lesions. Use gentle techniques and ensure minimal irritation to the lips and surrounding areas to maintain patient comfort and safety. Instrument stabilization is crucial for effective and safe instrumentation. Key factors include the instrument grasp and finger rest. Grasp can be modified pen and palm thumb. Finger rests can be intraoral, like conventional, cross arch, opposite arch, and finger on finger, while extraoral include palm up or palm down. These techniques ensure precision and prevent injury. The modified pen grasp involves the pad of the middle finger resting on the shank, enhancing tactile sensitivity. In contrast, the standard pen grasp uses the side of the middle finger. Modified pen grasp offers significant control during intraoral procedures, crucial for precision and patient safety. The triangle of forces or tripod effect enhances control during scaling by distributing force evenly. The modified pen grasp improves tactile sensitivity, allowing the middle finger's pad to detect surface irregularities on the tooth. This grasp is crucial for precise intraoral procedures, ensuring effective and controlled movements. The palm and thumb grasp is effective for stabilizing instruments during sharpening and manipulating air and water syringes. However, it is not recommended for periodontal instrumentation due to its limitations in maneuverability and tactile sensitivity. Finger rests are crucial for stability and control during dental procedures. They provide a fulcrum, enhancing precision and reducing hand fatigue. Proper finger rests ensure effective instrument manipulation, crucial for achieving optimal results in dental care. Understanding their importance is key to mastering dental techniques. Finger rests are crucial for precision and control during dental procedures. They provide stability by allowing the fingers to rest on a firm surface, reducing hand fatigue and enhancing accuracy. There are 4 types of intraoral finger rests that are conventional, in which finger rest adjacent to working area. Second is cross-arch finger rest, where rest is maintained on same arch but on opposite side. Third is opposite arch finger rest, wherein the rest is established on opposite arch. And lastly, finger on finger, where rest is on non-operating hand. Extraoral fulcrums are crucial for accessing maxillary posterior teeth. Unlike intraoral rests, they don't use fingertips or pads. Instead, the front or back surfaces of the fingers are placed on the patient's face, offering enhanced stability. This technique ensures effective instrumentation without relying on traditional finger rests. The 2 primary extraoral fulcrums are palm up and palm down. For the maxillary right posterior teeth, the backs of the fingers rest on the right lateral mandible. Conversely, for the maxillary left posterior teeth, the front surfaces of the fingers rest on the left lateral mandible, ensuring stability and precision. Reinforcing finger rests enhance control and pressure during instrumentation. The index finger is placed on the shank for the maxillary left mesial and lingual regions, while the thumb is used on the handle for the maxillary right posterior lingual region. This technique is crucial when the fulcrum is distant from the working end, ensuring precision. Adaptation involves positioning the working end of a periodontal instrument against the tooth surface. The goal is to align the instrument with the tooth's contour, ensuring precise adaptation to prevent trauma to soft tissues and root surfaces, while maximizing effectiveness. The Gracie Curette blade is divided into 3 segments: the lower 1/3, which includes the terminal few millimeters near the toe, the middle 1/3, and the upper 1/3 adjacent to the shank. Proper adaptation involves using the lower 1/3 to conform to the tooth's contour, ensuring effective and safe instrumentation. On convex surfaces like line angles and broader, flatter tooth surfaces, ensure that only 1 to 2 millimeters of the working end of the curette is adapted. This precise adaptation prevents trauma and discomfort, maintaining effective and safe periodontal instrumentation. Proper adaptation of a curette is crucial to avoid trauma. If only the middle third is adapted, the sharp tip may injure soft tissue. Incorrect adaptation, where the toe juts out, can lacerate tissues and damage the root surface. Ensuring the curette is properly adapted prevents these issues and maintains patient comfort. Angulation is crucial in dental procedures. For subgingival insertion, aim for an angle close to 0 degrees. During scaling and root planing, maintain an angle between 45 and 90 degrees. This ensures effective cleaning while minimizing tissue trauma. Proper angulation enhances precision and patient comfort. Blade angulation is crucial for effective dental procedures. At 0 degrees, it's ideal for blade insertion. For scaling and root planing, maintain between 45 to 90 degrees. Angles less than 45 or more than 90 degrees are incorrect for these procedures, though more than 90 degrees is suitable for gingival curettage. Lateral pressure is crucial in dental instrumentation. It involves applying force with a bladed instrument's cutting edge against a tooth surface. The pressure varies based on calculus type and stroke purpose, whether for initial scaling to remove calculus or root planing to smooth the root surface. 3 basic strokes are essential in dental instrumentation: the exploratory stroke, a light tactile stroke using probes and explorers to assess pocket dimensions and detect calculus respectively, the scaling stroke, a short powerful pull stroke with bladed instruments for calculus removal, and the root planing stroke. These strokes can be executed in vertical, oblique, or horizontal directions. The cutting edge targets the apical border of calculus, dislodging it with a firm coronal motion. This scaling stroke begins in the forearm, transmitted through the wrist to the hand with slight finger flexing. Wrist rotation synchronizes with forearm movement, pivoting on the finger rest for a powerful, effective stroke. Effective scaling requires precise wrist and forearm coordination. The wrist pivots in an arc, enhancing stroke power. This technique ensures efficient calculus removal, minimizing trauma. Proper wrist and forearm motion is crucial for optimal scaling results. Inspect instruments to ensure they are clean, sterile, and in good condition. Sharp working ends of pointed or bladed instruments enhance effectiveness, tactile sensitivity, and efficiency. Dull instruments lead to incomplete calculus removal and unnecessary trauma. Maintaining instruments in good condition is crucial for optimal performance. Maintaining a clean field is crucial for effective instrumentation. Saliva, blood, or debris can obscure visibility and impede control. Use saliva ejectors, aspirators, and gauze squares to manage these. Gingival bleeding is common, so flush the field with water and use air jets for visual inspection below the gingival margin. Ensure a firm finger rest on dry surfaces. Now the question-answer round. Question 1. What are the principles of periodontal instrumentations? Name them. Answer is, there are 6 in number: accessibility, visibility, illumination, retraction, stabilization and adaptation of instrument, activation of instrument, maintaining a clean field, and condition of instrument. Question 2. Where should be the position of the resting elbow of the clinician while instrumentation? Answers is close to the patient mouth. Question 3. How we can visually inspect the tooth surfaces just below the gingival margin during instrumentation. Answer is by gently packing the edge of gauze square into the pocket with back of curette and jet of air into the pocket. Can help us to visualize the tooth surface below gingival margin. Question 4. How many intraoral rests are there, and name them? Answer is 4 intraoral rests are present. They are conventional, cross arch, opposite arch, and finger on finger. Thank you for your patient listening. Here is a feedback QR code for your valuable inputs. This presentation has been drafted from the textbook Newman and Carranza's Clinical Periodontology, 13th edition, which is a comprehensive resource for understanding periodontal diseases. It covers diagnostic techniques, treatment planning, and the latest advancements in periodontal therapy. This book is essential for clinicians seeking to enhance their knowledge and skills in periodontology, providing evidence-based approaches and detailed illustrations for effective patient care.